So recently, what we've really come to realize and understand is that while we are a globally recognized organization, our friends up here, part of North America and Canada, have some specialized needs. Their healthcare system is very different than ours. And if you think about the scope and scale of Canada, the majority of people tend to live closer towards, the border, in the city areas, but they only maybe have maybe like five of what we would call aortic centers, five well-known established centers in all of their different provinces across east to west of Canada. Well, what happens if you're somebody that's not in the higher populated areas and you need to be transported to a regional medical center? They have basically one shot at thinking aorta. And if you're, meet these criteria or if you have family medical history. So everybody gets this one shot to kind of hit it out of the park, because if they send you home because they undiagnosed you, there's no guarantee that you're going to make it back for that second time and then still have to be transported to the right hospital who performs surgery. So it's kind of challenging. I do hear that there's phenomenal doctors there. It's just we need more people, right, to think about the aorta so that when presented with that, undiagnosed patient with chest pain, that they ask a little bit more probing questions, do a little bit more hands-on diagnostic testing, like checking blood pressure in both ankles or wrists, and determine it, if that patient needs to get in for a CT scan. We need to spread that message a little bit more. So Think Aorta is going to be launching in Canada in April. We're very excited about that. And because of that, we needed to really beef up our services a little bit more in order to offer support to those patients that are going to be hopefully diagnosed with aortic disease or be ready to be supported if they, have had an aortic dissection. So with that, we opened up the Aortic Hope private forum for Canada on Facebook. And we have 3 new volunteers who are going to be working with us to provide these services to the Canadians, basically. And that will include a support group meeting that begins the first Wednesday of every month starting in April. So our first volunteer that we're so excited is with us now watching is Velda Mackenzie. So she's the Aortic Hope Canadian team member, and she's going to be a director of support services, Canada. Her focus will be as a co-moderator of the online support groups and the meetings that we offer. And here's what she had to say about herself. I hope I don't butcher it as bad as I butchered Samantha's. My name is Velda Mackenzie. I live in Prince Edward Island. I used to work as a patient care worker at a psychiatric hospital and also worked as a fitness trainer. I did not know that about you, Velda. I have a daughter, a son, and 4 beautiful and talented grandkids. In February 2020, I had bad pain in my upper back. My left arm was numb and my neck was very painful. I thought it might be my heart, so I chewed 2 aspirin, but I kept fainting. I live with my best friend, Bella, my dog, and it was just the 2 of us at home. I had my cell phone in my pocket and called 911. I also called my good friend Kelly, who lives close by. I'm excited to be part of both Aortic Hope and Think Aorta Canada. Aortic Hope gives me hope by giving me the opportunity to be with others who have aortic disease. I feel it is my responsibility as an aortic dissection survivor to let as many people know about aortic dissection as possible and to help them be aware of the consequences, because it changes your life. I'd especially like to thank Karen Sue Anderson, that's me, for all she does with her endless energy and caring. She is my inspiration. Let's welcome Velda. Oh, you're very sweet, Velda. That was a very sweet message.
I'm not crying. You're crying.
You're crying. And you get to cry, and you get to cry, and you get to cry. Well, we're super excited. That's just going to be awesome to have her as a co-moderator of these support groups, because she does such a great job when she participates with all of our activities.